known. It's reliable. We know how to interpret it. It's not been done in one patient. I've examined tens of thousands of PSAs. So when you come to someone like me, you're talking about a guy that has been familiar with PSAs for decades. And experience matters. Experience matters a lot. So personally, unless there's some extenuating circumstance, I would stick with the PSA for most cases.
One last question. Do you have a urology department in your facility as well?
We have urologists that we work with closely. We actually have our own operating room, our own radiation room, our own CAT scanner room, our own hyperthermia room. So we have at access most everything one needs.
I appreciate that insight, and thank you, and have a good evening, sir.
Okay, grazie. Ciao. And we had another caller through. Are you still on the line, sir?
Yeah, this is Robert from Staten Island.
Okay, how are you tonight?
Good. I listen to your program every Sunday night.
Thank you.
And I find it very informative. I'm calling basically to order the booklet and the DVD.
Okay, you just have to call us during the work week, Monday through Friday, 9 to 5. Call us up Monday through Friday, 9 to 5. Same phone number, 212-CHOICES, and we'll put it in the mail to you at no charge, okay?
Yeah, were you ever affiliated with, what hospital on Staten Island was that? Staten Island University?
Years ago, yes, sir.
Yeah, okay.
All right.
Thank you, Dr.
All right, God bless you, and thank you, and talk to you tomorrow.
And keep up the good work.
All right, thank you. God bless you. Bye now.
God bless. Have a good night.
Thanks. And we're going to hear from our sponsor. We'll be back in just a moment. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
WOR, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're back, and we're back to talk about a lot of interesting things, good things, and other things. The good department. Well, let's talk about the good department for a minute. The incidence of strokes in the United States has declined significantly over the last 2 decades. So people called this morning and say, what are you doctors doing? Are we getting better or worse or what? Well, New York Times this week, an article by Nicholas Baccalar reported that there's a marked decrease in strokes. And actually another article which I talked about this morning on our morning show about the marked decrease in dementia in the United States. I mean, dramatic differences. This was an article that appeared in JAMA, and Nicholas reported a decrease that was apparent in people older than 65, the most common age for stroke, and there were similar decreases in men and women, in blacks and white. There was a decrease in the death rate from strokes. Researchers followed 14,000 people aged 45 to 64 at the start of the study. It went from 1987 to 2011, and after accounting for heart disease, hypertension, diabetes, smoking, etc., they found the incidence of stroke in the United States has fallen by 50%. and stroke death decreased by 40%. So what's the cause of this marked decrease in strokes? Well, smoking going down, better treatment of high blood pressure, and better treatment of high cholesterol probably are the cause. So we're making progress? Yes. And actually, with decreased smoking, there's less lung cancer, throat cancers, except for human papillomavirus. Right now there's an epidemic in men who acquire human papillomavirus, probably from oral sex. That's an epidemic, like Michael Douglas, if you remember, the big brouhaha when he talked to reporters about how he possibly got his throat cancer. So, yeah, there's a lot of good medical news, and this article from JAMA is one of them. And speaking of smoking-related cancers, I saw a woman this week with recurrent esophageal cancer. Now, she came to me 3 months ago. She had esophageal cancer. The esophagus is the tube between the mouth and the stomach. She had trouble swallowing. She was diagnosed when doctors did endoscopy. They looked into her esophagus. They biopsied it. They found cancer of the esophagus. She was given the routine therapy at a big cancer hospital nearby. She had surgery, standard chemo, radiation. And then she had trouble breathing and trouble speaking, and PET scan showed actually that she had 2 areas of recurrence. One recurrence was right by the incision of the esophagus, so probably spread by the surgeon, and the other recurrence was right where he opened up her chest, probably spread by the surgeon. So she came to us. She had seen many other doctors. She saw surgeons. She saw chemo. For whatever reason, she chose to proceed with us. We treated her 3 months ago. She came in this week with a new PET scan. Her breathing is better. Her speaking is better because the cancer recurrence choked off the nerve that kept her voice box from closing fully. And guess what? 3 months after treatment for recurrent esophageal cancer, she's in complete remission. The cancer's gone away. No new spots. The spots we treated are gone. It's a little bit strange. She saw a chemo doctor close to home, and her chemo doctor said he never saw cancer going away like this. In fact, the chemo doctor wanted to send her for a second opinion because they didn't know what to do with the cancer in remission. Well, I can assure you that we at Radiosurgery New York know what to do with the cancer in remission. Thank God. And many of our patients are in similar situations. This patient is happy. Her speech is better. Her breathing's better. Her cancer's gone. No new sites. And she tolerated treatment very, 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 very well. She came in with her husband and her son, and she was happy. All of us were. There were 4 of us in the room, the husband, the son, the patient, me, very happy. Should happen to all of us, cancer remission. And here's a woman, another woman, 60-year-old married woman who came with her husband. She had bilateral breast cancer at age 51. She chose to have mastectomies. We've talked about that before, that bilateral mastectomies are rarely needed. Unfortunately, they're more commonly done than they're needed, which is another conversation which we can have if you want. And even though she had both breasts removed, the cancer's come back. It's come back in what's called the cauda equina. Do you know that you have a cauda equina? Does anyone know what cauda equina is? A Latin term? Cauda, well, it means tail. Equina means horses. You got a horse's tail. Yeah, you got a horse's tail. Where's your horse's tail? Well, your horse's tail is at the bottom of your spine. That spine where it carries all the nerves from your brain down to your arms and legs and everywhere below. And then it breaks off into little nerves. So for a while, where the spinal cord is, it kind of looks like white asparagus. And then it breaks off into little nerves, little fibers, like a cauda equina, like a horse's tail. So we're treating her. She's fully intact. We're treating her to her cauda equina. She's going to have focused beam treatment to her cauda equina. She's in great shape. We hope to keep her in great shape, and we are obviously following her closely. She's happy to be with us. She did not want standard treatment. She had too much treatment, I think, 10 years ago, and is now focused on keeping her quality of life, and right now she has a great life. Another gentleman came in with PSA 6, Gleason 6. He's a 70-year-old man. What is our data for PSA 6, Gleason 6? It's pretty common. Actually, more men in America with prostate cancer have Gleason 6 than any other Gleason. Our data is about 95% cancer-free survival for Gleason 6, PSA 6. There's lots of options, and be happy to talk to you if you fit in that category. Again, we have data in our prostate cancer booklet, and it shows you all the comparison groups, radical surgery, different kinds of surgery, proton beam, all the other comparison. Why do I talk about it? Because we're better than the other guys. Just look at the data, and then look at the data, and let's talk. And another man came in this week with a happy man also. He had a mass on the side of his left neck from his mandible down to his collarbone, the size of two men's fists. Yeah, huge mass. So huge it was obstructing. He couldn't eat. He had a chicken bone caught in his throat. He couldn't swallow. He couldn't digest. Couldn't feel things. And it was unsightly. I think he was a little embarrassed, although he didn't say that. But a big mass. Came in, he decided he had all kinds of options, saw people for chemo and surgery and all kinds of stuff. His lymphoma. We treated it. One treatment, bam, 90% better. So this past week he got his second treatment. He'll be coming in this week, and I'll report back. And based upon the last week, I suspect his left neck is going to look pretty A-OK. I hope so. I pray so. I pray for good results for all our patients. And not only that, I fight for good results. And next man I want to talk about is a man with gastric cancer. He had trouble swallowing. Sometimes with gastric cancer, you're eating, but you feel like you're full early because the cancer is taking up part of your stomach. So normally your body has nerves like sensors, and when you eat, your body senses when you're full. Well, with gastric cancer, the cancer is taking up part of the stomach. He felt full after just a few bites. There's a word for that, early satiety. Satiety means satisfied, early satisfied. So you're satisfied after just a few bites. He had gastric cancer. He was sent to us by a surgeon. The surgeon tried to remove it. He could not remove it. We staged him up. In fact, he had metastasis to his liver, so he had stage 4 gastric cancer a year and a half ago. He had focused beam treatment to both the gastric cancer and the liver metastasis. And guess what? Yes, he's in complete remission today. The liver metastasis treated with 5 shots radiosurgery, completely gone. At the other hospital, he had a CT scan. Well, we're getting a PET scan because that's the most definitive test. By CT scan, he is in remission. Physical exam is perfect. He's gained weight, feeling fine, eating normally, carrying on normally, even though he had a stage 4 gastric cancer a year and a half ago. Treated then with radiosurgery, doing great. We're going to hear from a couple of voices from Radiosurgery New York. By the way, we're a cancer treatment center at 1384 Broadway and 38th Street. We take most insurances, Medicare, Medicaid. We specialize in non-invasive treatment like radiosurgery of the brain. We were the first in New York with brain radiosurgery, first in New York with fractionated brain radiosurgery. We're the first in the Western Hemisphere with body radiosurgery, first in America with body radiosurgery, and of course, first in New York with body radiosurgery. So we have a private cancer treatment center. It's a spacious center at 38th and Broadway. It's very convenient to get to. The reason to come to us is not for convenience. We want you to have the best possible care, and we believe we deliver great care. You get to speak to the doctor, not the machine. You have a board-certified doctor. not the student. That's how we do work at a private cancer center that's operated for you. You're our boss.